Hello friends, I'm Dr. Himanshu Tyagi and today I'll be talking to you about one of the most common causes of shoulder pain, rotator cuff tear. If you or a loved one has been experiencing pain while lifting the arm, difficulty sleeping on the shoulder, or weakness in shoulder movements, this video is for you. Let's break down what a rotator cuff tear is, why it happens, what symptoms it causes, and how we treat it. Firstly, let's understand what is the rotator cuff. The rotator cuff is a group of four muscles and their tendons that surround the shoulder joint. These muscles help lift and rotate your arm and keep the shoulder joint stable. Think of them as the engine behind all your shoulder movements, from combing your hair to lifting groceries to reaching overhead. When one or more of these tendons is torn, either partially or completely, it leads to a rotator cuff tear. This tear can limit your shoulder movement, cause pain, and over time affect your quality of life. Next, let's understand what causes rotator cuff tears. There are two broad categories. One, acute tears, sudden injury. These happen due to a sudden force or injury. For example, falling on an outstretched arm or lifting something too heavy with a jerking motion or sudden shoulder dislocation. This is more common in younger individuals or athletes. The second category is the degenerative tears or age-related wear and tear. This is the most common type and occurs due to age-related changes in the tendon. Repeated use of the shoulder in overhead activities like painting, swimming, or tennis, or poor posture and muscle imbalances, or reduced blood supply to the tendons as we age. Degenerative tears usually affect people over 40 or 50 years of age and may start gradually. Now let's talk about the common symptoms of rotator cuff tear. The symptoms of a rotator cuff tear can range from mild to severe. Common signs include pain, especially while lifting or lowering the arm. It may also worsen at night or while sleeping on the affected side. Weakness. You may find it hard to lift your arm or do overhead activities. Cracking sound, some people hear or feel a clicking or popping sensation when moving their shoulder. Limited range of motion, you may find it hard to reach behind your back or lift your arm fully. Night pain, especially common in partial tears. Many patients say, "Doctor, I just can't lift my arm like I used to," or "I wake up at night with shoulder pain." These are classic red flags. Now let's talk about how is it diagnosed. Your orthopedic surgeon will first ask you about your symptoms, medical history, and activity level. Then, a physical examination will test for arm strength or range of motion or specific clinical signs for rotator cuff function. We may order imaging tests like MRI to diagnose it. Till date, MRI is the most detailed scan to assess tendon damage and tear size. MRI is especially useful when we are considering surgery. Now, what are the treatment options once the tear is diagnosed? The good news is that not all rotator cuff tears need surgery. Treatment depends on the severity of the tear, the patient's age, activity level, and how long the symptoms have been there. Non-surgical treatment works well for partial tears or small tears or in older or low demand patients or in patients with minimal pain or functional loss. Non-surgical options includes avoid heavy lifting or overhead activities or ice packs application to reduce inflammation and pain, or medications like painkillers or anti-inflammatory drugs or physiotherapy to strengthening shoulder muscles and improving flexibility. Most patients start to feel better in 6 to 12 weeks with conservative treatment. Surgery is usually recommended when pain persists despite 3-6 months of conservative treatment, or there is a complete tear, especially in younger or active patients, or shoulder weakness is affecting quality of life, or the tear is large or progressing fast. Surgery involves reattaching the torn tendon to the bone. Today, this is most commonly done using arthroscopic techniques, which are minimally invasive. Tiny incisions and a camera allow us to perform the repair with less pain and faster recovery. Sometimes, in massive or irreparable tears, we may consider tendon transfer surgery or a superior capsule reconstruction or shoulder replacement. For end-stage rotator cuff arthropathy, the recovery and rehabilitation part depends on the type of tear and treatment. Normally, after surgery, a sling is worn for a few weeks. Physiotherapy starts gradually, passive movements first, then active, and then strengthening. Full recovery can take 4 to 6 months. Patience and consistency are key. Even after non-surgical treatment, continuing shoulder exercises helps prevent recurrence. PLs understand that rotator cuff tears are very common, especially as we age, but they don't have to stop you from living an active life. Early diagnosis and the right treatment can help you regain strength, mobility, and a pain-free shoulder. If you or someone you know is struggling with shoulder pain, don't delay. Reach out to your orthopedic specialist for an accurate diagnosis and personalized treatment. Thank you for watching. If you found this video helpful, do like and share it with others who may benefit. Feel free to comment your questions or book a consultation with us.